Hi, I'm Dr. Kara Criswell.
And I'm Dr. Bryan Criswell, and we are Criswell and Criswell Plastic Surgery.
Welcome to our virtual Ellacor experience. We're very excited to have you all here with us tonight.
Please be sure to stay until the end for some fantastic question and answers.
You can submit your questions through the questions tab.
There'll be some prizes at the end for our participants who stay until the very end.
Thank you for joining us. We're excited to bring Ellacor to our practice because this modality is the first of its kind. The technology behind it just makes sense. You're able to remove skin without surgery.
That's right. Ellacor removes full thickness skin without surgical scars or surgery. So it's alternative to surgery. By removing the skin tightens, so it treats lines and wrinkles and skin laxity, and it also helps your body rejuvenate collagen. So there's a tremendous amount of improvement in your skin texture, tone, as well as tightness. It's a fantastic alternative to surgery.
What makes Ellacor unique? Ellacor is unique because it improves your skin laxity with microcoring technology. It physically removes up to 8% of your skin from the certain area being treated with no surgery and no heat.
While we've previously spoken about how fantastic Ellacor is for treating the face and neck, tonight we're talking about Ellacor to the body. And the areas that you can treat with Ellacor are areas that surgery might not even be a great option for. So somebody who has just a little bit of laxity of their abdomen or a little bit of laxity above their knees, maybe some laxity of their arms, but not quite enough to need surgical intervention, or if the patient just doesn't want surgical intervention.
That's right. Really, Ellacor can treat just about any area of the body that has skin, which is most of our body. So we treat elbows and upper arms, chest, abdomen, back, the thighs. It's just a fantastic modality for just about any place on your body.
So what makes you a good candidate for an Ellacor treatment? Ellacor is a great option for you if you have skin laxity in the arms, the abdomen, the inner thighs, the knees, and you don't want to have the downtime from a surgical procedure. This is a non-surgical treatment.
So one of the benefits of Ellacor being non-surgical is there's no real downtime. In fact, you really can do pretty much anything right after the treatment.
If you have a surgical procedure, say, there's frequently 1, 2, 3 weeks, 4 weeks, sometimes 6 weeks of true downtime. With Ellacor, there's no downtime. You're back to doing what you want to do the next day.
There's marks from where the treatment areas were performed, and how long those little grid marks last is very patient dependent. It's dependent on the area treated. It depends on the density of the treatment that's performed, age of the patient. So there's no hard and fast rule for how long those grid marks last, but I would expect to have maybe a little bit of redness of those areas for a few weeks.
Hey everybody, my name is Jessica, one of the nurses here that performs Ellacor Body. And for the treatment, what you could expect that day is you would come into our office and we would apply numbing cream and take some photos. Then once you are fully numb and comfortable, we would then inject numbing medication so that you're fully comfortable for the procedure. Then the procedure itself is relatively painless. Most people rate the pain score anywhere from a 0 to 3. Then throughout the procedure, it takes about 30 to 45 minutes to complete. And then we get you ready with your post-care treatments and send you on your way. Thank you guys so much for attending. We had so much fun with you guys.
Winners will be notified by email or phone.
The chat will remain open for the next 15 to 20 minutes, so feel free to send in any questions that you guys may have.
Had so much fun with you all.
Bye.
Hi, everyone. Welcome to the Ellacor Body virtual event. We are joined by Drs. Bryan and Kara Criswell. We're so excited to have you all here. Before we get started, just a reminder to please put your questions in the question box. We will be answering them. I know that video said that questions will be open for the next 15 or 20 minutes. They're actually going to be open longer than that. We would love to hear from you. Also, another reminder that there can be a chance to win an amazing prize for those of you who stay till the very end. We will be notifying that winner personally after the end of our program. Again, now let me introduce Drs. Bryan and Kara Criswell.
Hello, good evening.
Hey, everyone. Well, we've got some questions, so let's get started.
Great. Our first question is, how does one know if Ellacor or CO2 laser is more appropriate for facial issues?
There are two entirely different modalities. So you've got laser versus Ellacor, which is really its own modality. CO2 laser, we actually use an erbium YAG laser. We feel it's a little bit safer than CO2, but just as effective. But a laser is an ablative treatment that removes the top layer of skin, stimulates collagen growth. It can cause some skin tightening, but primarily it's for skin resurfacing to give a better quality to the skin, better appearance to the skin.
So for fine lines and wrinkles, texture issues, pigment issues, but you're not removing skin. So that's the difference. In addition, the CO2 laser is using heat. And so the downtime for that is very different than an Ellacor treatment. So you're ablating the skin, meaning taking off top layers of skin, which is very effective and is a great treatment. However, with Ellacor, you're removing skin. So if there's more of a sagging skin rather than a skin texture issue, Ellacor may be the better thing to start with. Now, both of those modalities can be used together. Anything you do with the Ellacor can actually augment the results of your Ellacor treatment.
Great. So we have some more questions. What is the cost and how many treatments do you need?
So Ellacor is a non-invasive treatment. I mean, it's a little invasive, and it's actually removing cores of skin, but it's considered a non-invasive treatment. So in plastic surgery, if something is non-invasive, you're going to see results with one treatment, but you're going to get more results with a second or third treatment. So for the body, we generally recommend planning on 3 treatments. You're going to see a result after 1 or 2 treatments. You're probably going to want 3 treatments, and you can do more, but generally 3 treatments for the body.
Because every time you do treat the area, you can remove up to 8% of the skin. So let's say we have a series of 3, which is kind of what we recommend for body parts. That let's say you want to do it again in 6 months to a year, you can continue to treat to correction. And that's one of the great things about Ellacor is it's safe to repeat these treatments.
We have a very specific question about a specific body area for treatment. So someone wanted to know, above the knees, do you need multiple treatments? And then someone else asked, how do you know how long to wait in between treatments?
So, it really depends on each individual. And I would say with any body part, we're going to recommend 3 treatments, even if it's some crepiness above the knees. You don't treat just that one area. You treat above as well to kind of distract that skin up, to cause the skin to tighten even above where the knees are, to pull that skin to deal with that laxity. I forgot the second half of the question. What was that?
They're wondering in between treatments, how long?
We're normally waiting about 4 to 6 weeks. Now, some of the collagen remodeling will take longer than that. And so you do have improvements after that 6-week period, but we want those marks to resolve and give the body a time to heal, to be able to come back safely and do another treatment. Don't you think so? Yeah.
It's certainly safe to treat 3 to 4 weeks after the treatment. Most people are not quite ready yet. You may still see just a hint of a little bit of pink at that time. Many people not. As soon as the color is completely gone, it's safe to proceed with another.
I mean, we answered this a little bit, I think, but to go into more treatment or detail, they're asking kind of what does post-treatment care look like also as they're in between those treatments?
Right. I mean, it's pretty straightforward. With laser treatments or Halo, TRL, there is some downtime in terms of what creams, ointments, whatever you need to do to help that skin, that skin that has been treated with thermal energy, to have that heal. With Ellacor, you've done the treatment, that's kind of it. Now, we recommend exosomes. There's other products to help mitigate how how long the redness lasts, but it's not the same kind of post-treatment care that you need to be really meticulous with, like a laser treatment.
Yeah, you're getting in the shower, soap and water, the area that is treated is not tender, doesn't hurt. We do recommend using exosomes. Occasionally we use PRP, but exosomes function like stem cells, so they help the overall healing process, help more collagen rejuvenation, and help the healing go faster. So we do recommend exosomes. But other than just applying exosomes like you would a serum, you're not doing a whole lot in terms of caring for your skin.
Aside from the normal care that you give your skin.
Right.
Again, a very specific question, but I think a lot of people have this about underarm skin and kind of, is how much skin is too much. For example, this particular person asked, they said they have 2 to 3 inches they're concerned about and want to know, what is that treatment?
So, yeah. First of all, it sounds like maybe having a consultation where we could actually look at the areas you're talking about would be helpful. Because 2 to 3 inches may mean something different. There are cases where there's enough skin laxity that really surgical treatment is going to be the best option or the only option. 2 to 3 inches of skin to someone, maybe crepey, loose skin, and we're able to tighten that with Ellacor, so the skin tightens up and you have a better shape. Could be that 2 to 3 inches of skin is really just a surgical procedure.
He also wanted to know, you mentioned crepey skin. If someone has what they consider a bunch of crepey skin, are they a candidate?
Ellacor is great for a bunch of crepey skin. It probably is the best thing. I mean, you can do an abdominoplasty on someone and pull the skin down as tight as possible with an abdominoplasty. And then 6 months or a year later, if they were troubled with some crepey skin around their belly button, their upper part of their abdomen, or they lost a little more weight, really surgical treatment is not going to change that. But if it's the crepey skin, Ellacor can address that.
Right. I mean, with surgery, you might be removing some of the crepey skin, but if you're sewing crepey skin to crepey skin, there's still going to be crepey skin, even and now with a scar. And so one of the things that we talk about with even our surgical procedures, if there's a skin quality issue, we want to treat that skin quality so that your surgical result will be better.
Ellacor is great for post-surgical indications as well. So let's say we discuss your options. Sounds like surgery is a good option for you. Undergo surgery, and whether that's an abdominoplasty or an arm lift or a thigh lift
Or facelift.
Then Ellacor can be used after the fact. It can be used to treat scars, so it can make the scar appearance better. It can also tighten any residual crepey skin you might have that is not able to be physically formally excised by surgery.
We've had several questions. People are wondering about the cost per treatment and really kind of better understanding of how many treatments they need, knowing that I think it's very specific to what area they're treating.
Yeah, it is very patient dependent. And as Brian mentioned before, one treatment, you're going to see a difference. Now, with some body parts, we are recommending a series, but ultimately it's your decision. You may be happy with the one treatment. So I think that that's something that's very patient dependent. As far as cost per body part.
So it's $3,000 for a body part treatment. So that might be both of your knees. That's one body part. That'd be $3,000 for the first treatment. Subsequent treatments to both knees would be $2,500. We don't package these as a series where you're forced to buy a package of 3, because plenty of people see results after 1 or 2 and they don't feel they need the third. And so we price them individually, but there's a decreased price for the subsequent treatments.
One person asked, since summer is approaching, would we need to avoid sun exposure for a period of time following Ellacor?
That's a great question. And yes, so a period of time you would. I mean, normal sunscreen is going to protect your skin, but you want to really baby that area that's been treated. So this is an area that it does heal very quickly, but we would encourage people to be out of the sun for, I want to say, a couple of weeks at least after the treatment.
And until the majority of the we call them dots, but you can see
Grid
where
marks.
the treatment grid marks are, till those have faded and you're just looking at normal healthy skin, then you can be out in the sun, just being sure to use sunscreen.
Which is different than a thermal energy treatment like a laser. With that, then we have to be a little bit more meticulous about being out of the sun, out of direct sunlight, just to avoid hyper and hypopigmentation.
You mentioned scar treatment. Is there a minimum requirement for size or surface area treated?
I wouldn't think so.
There's not.
There's
not. When we're doing Ellacor treatment, we're typically removing somewhere between 8,000 and 12,000 cores of individual skin.
Right.
And that is a very large surface area. So we can treat an entire abdomen in one treatment. If someone wanted to do their abdomen and also do their knees, then we would need to use a new head for the machine, which has the needles, so they need to be sharp. So if we're doing two entirely different body parts, then it's going to be two different heads. But there's really no limit on the surface area that we can treat.
Right. So if there's a long scar, we're not gonna run out of time on the individual head to be able to treat an entire scar, or two scars if we're talking about breast scars.
Great. Before we go on to our next question, we just want to remind everyone who has tuned in today you'll be receiving a text message, and please reply with the code word BODY to be contacted for a consultation. And please enter your questions into the questions tab. We love getting these questions from all of you. Another question that we have is, someone just addressed scars, but really let's talk specific scars, like a C-section scar, for example. I know that's a sensitive area. How would you treat that, and can you treat it?
Absolutely. And the way we do any of the treatments is we're making sure that our patients are completely comfortable. So we start the treatment with topical numbing cream. And what that's going to do is making the subsequent injections of the local anesthetic and tumescent fluid much more tolerable and pretty much painless. Once that area is numbed with that local anesthetic, you are not going to feel any discomfort from the Ellacor machine. So yes, that's a sensitive area, but we're going to completely numb any area that we treat with Ellacor.
And C-section scars are great. It's a great area, a reason to treat with Ellacor. Just like any scar on the body, because it is actually removing some of the scar, and then your body heals without scar in those areas. So it's making new healthy skin in those areas.
Speaking of keeping your patients comfortable, people want to know, like, what is the pain level of this treatment? I know you addressed it a little bit at the top, but I think, everybody would like to know, like, just what am I going to feel?
Well, I think you could kind of see from, if anyone's gone to our social media, I kind of went through each step when I had it done. And I had the topical numbing cream on, which I always have a little bit of reaction to. So my face gets a little swollen, and with the local anesthetic as well. So with the numbing cream, I really did not feel the individual needle sticks to inject the local anesthetic. And throughout the case, I didn't feel anything. I felt pressure from the machine. You feel it kind of jiggle you a little bit, but it was completely painless. And afterwards, it did not hurt at all, like at all.
For most body treatments, you're easily able to have a laughing conversation during the procedure. It's that comfortable. Now, occasionally you may feel a little pinch, but it's not a sharp pinch. And those are kind of isolated areas. It is a very comfortable treatment.
So let's say for those of us who perhaps don't even want to feel a little bit uncomfortable, the question would be, can you take something for the pain? And then if you're having a body treatment done, can I drive myself home? So let's say knees or legs.
That's great. So for the face, some of our patients will like to have something for the numbing process. So they may take a little bit of a relaxant medication. Most patients don't need it. Most patients don't want it. It's not necessary. For the body, it is almost never needed. So I don't think we've done it for the body.
No.
It's so comfortable. You don't need to take something orally for it.
But if someone has a lot of anxiety about it and has some anxiety about the treatment and wanted to take a small anxiolytic beforehand, that is totally fine. We can help make that happen, but you would need a driver afterwards. Now, we do also offer Pronox, which is basically like laughing gas. And so with Pronox use, if you're not taking any oral medication, that is something that clears very quickly, and you would be able to drive yourself home afterwards.
So the average person who's not taking an oral anxiolytic, they can certainly drive themselves home. You're going to feel fine. For the person who's using Pronox to help with the anxiety and possible discomfort, they can drive home as well.
All right, so this is a two-part question. The first would be, how long does it take a treatment to take for face and neck? So if you had one treatment in your office, how much time are we talking?
I think the long part of the treatment is getting the patient completely comfortable beforehand. So we leave the numbing cream on at least 15 to 30 minutes. So during that time period, you can be on your phone, listen to music, read a book, whatever you want to do. The injection process takes about 10 to 15 minutes. So once the numbing cream has taken effect, we wash that off. We inject the local anesthetic. That maybe takes about 10 to 15 minutes. We want to then make sure that that is completely taken effect. So I have to walk out of the room because I always want to start right away. So I'll walk out of the room, give my patients 5 to 10 minutes, and then come back in and start the procedure. Once we start that, the Ellacor, it goes very quickly. I would say, how long do you think for a face? Maybe 20 minutes?
About 20 minutes to treat the full face,
Yeah.
And another
10 to 15.
10 to 15 to
Yeah.
treat the neck.
Great. And the second body part they mentioned is abdominal area. After you go through all of that, how long for abdominal area?
So it goes a little bit quicker because the numbing cream you don't have as many nerve endings on your abdomen. So injecting the local anesthetic is pretty comfortable, even if you didn't use numbing cream, but we do use numbing cream. With that, it's basically kind of the amount of surface area. But I would tell you that most likely it would be about 15 to 30 minutes for an abdomen, kind of depending on the size of the person, the density that you're choosing for the pixelated needle sticks. And that would kind of depend. You want to get as many cores out as you can. So you're going to go until the head of the machine shuts down. And that's usually about 15 to 30 minutes max.
I agree.
Great. Before we take our next question, just a reminder to those of you that are on the line that we really want to hear your questions, and there is no question they're not willing to answer. I think this is a great way to really get deep into this treatment to learn more. And I think the question everyone wants to know then is, how long until I see final results? So not initial results, but like the good stuff at the end.
But you will see results in the first few weeks, and some of that's temporary, a little bit of swelling, not like you're swollen super large, but a little bit of swelling, skin will tighten up some. That goes away after the first 2 weeks or so. And you'll see an improvement in your skin quality. You see an improvement in skin tightening. It takes 3 months for collagen to fully rejuvenate. So your results continue to improve, but you haven't seen the full effects for 3 months. So when someone who's having a second treatment or a third treatment, they have the second treatment at 6 weeks or 8 weeks, they still haven't seen the final result from the first. So the results just keep getting better.
Which goes into a next question. Is it permanent?
Well, we don't freeze in time, right? So you have a laser procedure, you have an Ellacor, you have Botox,
Surgery.
you have surgery. We're constantly, living, right? And so it is that area of skin is permanently removed. So that area is permanently removed, but you still have the rest of your skin. And so you will have an improvement, but we age every minute, right? And so I think you can't look at anything you have as a permanence, be it Botox, be it surgery, be it the car you drive, the meal you ate, whatever it is. Nothing's permanent with that, but you do see a tremendous difference. Now, one caveat to that would be if someone had a real texture issue, or this was a scar that we're treating, or a very localized area, and you're removing that poor quality skin, and you were not going to have, let's say, another baby or whatever it is that resulted in that kind of crepey skin, that I would say is more of a permanent result.
Yeah, I agree. I think about procedures about similar to getting a suntan. You go to the tanning salon, you go to the beach, and you get a tan.
A tanning salon.
People still go to, well, okay, spray tan salon. All right. So if you get a tan, however you're getting it, that's temporary. As soon as you stop the sun or the artificial colors, it's going to go away. All right. So some treatments can be temporary. Ellacor is permanent in that the results are permanent. But like Kara was saying, your body continues to age after the fact.
They wanted to know if there are any before and after photos available, which I love this because we know there are.
Yes, we do. We have what in that video beforehand, those were our patients. So those are some of our patient examples. And we will continue to build more and more before and after photos on our website, and as well as being able to see some of the photos when you're in the office too.
Another question is, can it be done around the eye area?
So you can go up to the orbital rim. So right up here to deal with some of those crow's feet area. I would say that you don't want to go any further than that because of the change in the skin quality there. It's not a good area to treat with that, but you can get right up to the orbital rim. So a lot of the crow's feet with that. Now those marks may last a little bit longer in that area, or just be a little bit more visible because that's right in an area that you're looking at all the time. But it is an area to treat, and I like to go all the way up there.
It's like, if any of you have had Botox before, the area that's most common to bruise is the crow's feet or the area around the eye. There's lots of tiny little blood vessels. So when we take Ellacor up here, and we do, you're more likely to have a little bruise there. You're more likely to see the grid marks last a little bit longer in that area.
But skin can be removed from that area, yes.
What can I do to optimize my recovery?
So I think having good skincare both before and after, and we are instituting some protocols on what to do before and after to maximize the results and minimize the downtime from it. And again, the downtime It's not the same as other treatments. It's just there's a little pixelated pattern there, which actually can be covered with mineral makeup in a few days. So I think that there's certain being on a good skincare regimen beforehand, and I would say a physician grade skincare regimen beforehand is going to speed the healing process with that.
You know, for when we're doing face Ellacor, I do recommend patients be on Retin-A ahead of time. You don't have to be, but Retin-A causes more rapid turnover, so you heal faster after lasers or Ellacor. Same thing with body. You can use the Retin-A ahead of time. Probably more important that you treat with exosomes after the fact. Exosomes do speed up healing and give you a better result.
Speaking of healing, so how noticeable is it to others? For example, would I need to plan it around social events where maybe I'm not going to be leaving my house, or if I need to be on camera for work, or whatever the case may be?
So we talk about Ellacor not having any downtime per se. You can be back to work the next day, but we talk about it having some social downtime. And so for the face, you can expect to see visible dots, visible grid dots for a good 5 to 6 days. That's a little hard to cover with makeup, and usually by a week you can cover with makeup. For the body, it is extraordinarily variable. So you can have some dots that really are mostly faded within 1 to 2 weeks, and you can have some dots that you can still see 1 to 2 months. And so after your skin is healed, you can cover with makeup. Most people don't put makeup on their body, but you can. So you do have to plan around social events. There's some social downtime.
That being said, I showed up in the office like the day after and just was like, here I am. This is what it looks like. And every day I'd come in and patients would say, oh, you had the Ellacor. Yes, I did. So I think it depends on each individual's comfort level with it. It doesn't look like anything else except little stamp marks on the face. So it's not oozy, it's not bleedy, it's just looks like you have a little stamp marks.
If you have a major social event, you're going to wear something strapless, you want to have your upper arm axilla done, you want to give yourself, what would you say, 6 weeks?
I would say,
Yeah.
I mean, if that.
Because they may be gone by 6 weeks, but maybe
you
not.
just don't know. It's because it's variable based again on patient skin, age of the patient, health of the patient, density treated, etc.
What exactly is the tegaderm placed on body part after procedure, and is there anything to watch out for afterwards to protect your bedding from procedure during healing?
So the tegaderm is put on right after the treatment, just kind of keep everything covered and protected. We recommend to try to keep that on at least 12 hours. Some patients are able to keep it on overnight. There's nothing perfectly magic about it. It's just to kind of protect the skin for right after the treatment.
And your bedding.
Yeah, I didn't really get all over the place.
No.
But
there is a little punctate bleeding during the procedure. There are tiny little needles, but generally by the time the procedure is done, so whether that's 20 minutes, 30 minutes, there's no more bleeding. So there's no more blood. And so you can get in bed and there's not bleeding.
Now you want to make sure you have a clean pillowcase, and it may be not your best pillowcase in case there is a little punctate bleeding there, but it's not like you have to put down towels or chuck pads or anything like that.
Which goes to our next question: how long until I can cover the body area with clothes? So like, let's say they're having a treatment done on their stomach. Can they wear pants that would be maybe rubbing up against that area, or a shirt that would be tight on the arms?
I think you could put it on tomorrow, the day after. I mean, really, if it's
The morning after.
Yeah, I mean, if it's really digging into you, that might be a little uncomfortable. You don't want to chafe that area that's healing. But I haven't specifically told patients you got to wear a certain item of clothing or not avoid any clothing after having body Ellacor.
No, you wear whatever you want the next day.
Just a reminder again, we love these questions, especially when they're really specific. So feel free to put them in the questions tab. I know that doctors are enjoying answering them for you. So people want to know, I'm considering a tummy tuck or an arm lift. Should I do this before or after?
I think you got to have a consultation first. I think that's going to be the thing to know, because if it is just a little bit of skin laxity, a little bit of crepiness, you might not elect to have surgery for that. I would say that if you're borderline, it's not, you can do it either way. I think the one thing I would say is if you're going to have surgery and you're considering doing Ellacor, I would probably say do the Ellacor after surgery so that you can address the scars with it.
I agree.
And for those of us who like having a lot of things done at once, let's say we have Ellacor, can I combine it with things like fillers or Botox, or would you suggest spacing those out?
I think I would probably encourage you to space them out.
It's safe to combine them.
but I would space them out. It's just too much in your day.
What should I wear the day of my procedure and having procedures done on my arms?
I would say loose long sleeve t-shirt would be fine. I mean, I think that anything comfortable, again, you don't want something so tight that it's rubbing and hurting, but something loose and comfortable is fine to wear.
And if you're going straight to your car and going straight home,
Tank top is fine.
Tank top, short sleeve shirt, as long as you're okay. If someone who sees you does see that and you're getting home, so something loose and comfortable.
We talked a lot about the procedure itself and what to expect after, but let's talk about before we even have the procedure, like that consultation. So I'm coming in and I'm talking to you about, here's an area that I would like to improve on. What would you take me through? What would that look like?
I think the questions I would say is you got to describe exactly what it is that bothers you, and what is your expectation in terms of result, and what is your goal for your result. I think that knowing somebody's history and physical is very important for any kind of procedure you do on somebody. What medications are you on? What other health issues do you have going on? Have you had a significant weight loss? We have a lot of patients who are on the GLP-1s who have had tremendous and fantastic weight loss, which has just completely changed their overall health status. And so someone who may have been a diabetic or had been on CPAP or have been on a lot of medications now isn't on them anymore. So it's good to have that full evaluation beforehand, and that would determine whether or not is this the appropriate thing for you. I think that it's pretty common that we'll say no. I think that's, you can kind of trust us to give you an honest opinion on what's going to give you the best result.
Well, we have just our overall practice philosophy is we have happy patients, and there's a reason. So once you verbalize kind of what your hopes are, your goals are, then we're going to guide you the best about whether that's realistic and what is realistic, and whether that's surgical or whether that's with Ellacor. We're going to guide you the best we can because we want you happy.
When we're talking about treatment around the mouth area, what if I'm someone who deals with cold sores in that area? What should I be concerned about, or what should I be looking out for in that area?
It's a great treatment. Any type of stimulation procedure, whether it's laser or Ellacor or injectables around the mouth, and someone who's prone to getting cold sores can stimulate cold sores. So typically we will have them start prophylactically treating with whatever their medication they normally use, the antivirals, before the procedure, and then continue on those afterwards as well.
What moisturizer is recommended to use for the first few days after the procedure and before the start of, I'm going to have you read this one, Jen.
Close needed off.
Thank you. Thank you for a great question.
So we encourage our patients to do the exosomes in between. Now that's not super hydrating, but any kind of good moisturizer, Obagi Hydrate is one. We've talked about using the nectar. There's a lot of products that are, as long as they're physician grade. And honestly, we also talk to our esthetician, Stephanie, and sometimes she will give us some good ideas about what to do. We've had patients use anything from coconut oil to Obagi Hydrate to Eucerin lotion. It just kind of depends on each individual with that and what your face is normally used to. Again, it's not a laser, so you can go back to your own skincare regimen pretty quickly.
Great. Just one last reminder for people who want to put questions in. It looks like we're kind of winding down, but just a few more as we look at this. Based on kind of what you typically see for results, what would be kind of like that realistic outlook for someone when you say, okay, this is the right treatment for you? I think comfort level is always really important, right?
Right. Absolutely. I think that the great thing about Ellacor is if someone is kind of on the fence about whether or not they're really a surgical candidate, or the area that is bothering them is really localized or really isn't a good area to deal with surgically, I think Ellacor is perfect for that. So, I mean, to try to lift skin above the knees, you're not going to put a scar on somebody for that. If somebody has some crepiness up in their armpit, it's hard to put a scar. You can't really do a scar there. You can't really cut somebody to remove the skin there. If someone has just a little bit of localized crepiness around their belly button, they're not necessarily a candidate for a tummy tuck. The weenus, I hear about the elbow skin. That's a great area to treat with Ellacor because, again, you can't really use surgery on that area. So I think that the great thing about it is because it's removing skin and because it's stimulating collagen, even if it is not completely resolving some lax skin, it may be enough of a significant change in the quality of the skin that that area is no longer of concern.
Can't add to that.
Oh, thanks.
Perfect answer. So would you recommend this for acne scarring on the face or on the arms?
I think it's a great treatment for acne scarring. Now, true deep ice pick acne scarring, that may require a subcision or excision of a direct scar, but it is because you're removing the little cores of skin, you can really treat those areas of scarring and smooth that out. It's a great option.
If I had my choice, it'd be Ellacor combined with our Erbium YAG TRL laser. Or some people are familiar with the CO2 laser. So you can combine the Ellacor with a deep ablative laser to treat the difficult acne scarring.
And someone asked, what if I have a tattoo in the area and how is that affected by the procedure?
Well, it depends on if you want to keep it or if you want to get rid of it. So if it's a tattoo that you're trying to maintain, then we wouldn't go over that area with the Ellacor, because again, you're removing plugs of skin.
If the crepiness bothers you enough in that area, we would treat that area with the tattoo, which is safe to do, but you're probably going to need a touch-up of your tattoo.
Yeah.
Which goes into, when you talk about the touch-up, who's actually performing this procedure? Is it the both of you?
So for facial Ellacor, face and neck, it is us. For body Ellacor, it is both Brian and I, and Lacey and Jessica, our nurse providers, who are excellent at this procedure as well.
Great. I believe those are all of our questions, unless we get any last questions. Again, we want to thank everyone who was able to stay on for so long. Like we mentioned at the start, for those who stayed on throughout, we are going to have a drawing for a very special prize, and you will be contacted after this is over by someone here at the Criswell and Criswell staff to let you know if you won. Doctors, you want to end out with any kind of wise words for our viewers?
I think that we really appreciate you all spending your evening with us. The questions were awesome. Really good job, guys. That was really great. I think we were able to touch on a lot of things. If there are any of the questions that we didn't, please just call our office, send a message through email, our nurse at Criswell Plastics as well. Come in and see us. Come in and see us. Come in and see Jessica. Come in and see Lacey. Come talk to us about what your concerns are. That's what we're here for.
Text us through our website. We respond to texts, whatever's best for you.
Thank you very much, guys.
All right. Y'all have a good night.
Bye-bye.
Bye.